Hi everyone, my name is Darish Rezai. My student number is N41371728. Contemporary issue is a model name. Introduction. Health is one of the most important value in every person's life. And for this reason, the health system is very important in every country. There are many problems in the health system. These problems cause the quality of the service to decrease and they cause people to be dissatisfied. In this article, I try to point out some issues, and by analyzing and defining them, we will understand the reason for the weakness and incapacity of the health system. In the following, by highlighting one of the reasons for the weakness, how is related to the positive and negative effects in the health system. And finally, by presenting several theories and suggestions, I try to find the solution for the progress of the system and their preparation for the future problems. Issues. Workforce. The workforce crisis in the health system is quite visible. Since 2021, the first time the number of the people working in social care is decreasing, and now there are nearly 160,000 vacant jobs. The lack of the experience and suitable personnel will cause many problems in the system. One of those problems that all patients and those who needs care are involved with the long queue in the health centers. Funding. The government budget for the health system 2023-2024, the allocation is about 160 billion pound. With the advance of the medical science, treatment methods have become more advanced, and these advanced treatment have also put higher costs on the government. With the increase in population and the price of the care package for patients who have difficult and complex care needs, the money required by the health system in England increases every year. The budget of the health system, especially adult social care, has been leaking for several years. Immigration policies. About one from 5 of social care workers in England are foreigners, especially in London, where this number increases. After the approval of the new law regarding the immigration in England, we will see that there are many restrictions to enter England for people who are looking for work or want to live in England. These policies can remove England from the list of their desired country and attract their attention to the other countries. This action will cause crisis in the UK labour market. According to the statistic, significant percentage of the health system employers, whether in the low rank or specialist rank, they are non-British employers. This restriction will disrupt the supply of the labor in this sector and cause shortage of human resources. Brexit. The economic downturn in the early years caused the government to allocate less funding for the health system. They therefore caused the dissatisfaction of many health system workers. Medicine and the medical parts import from the European Union to the UK were more expensive because the value of the pound dropped down. Either they have become more expensive due to the import restrictions, or import was stopped altogether. Another effect was the restrict the entry of the specialists such as general practitioners and the nurses and the social workers into the UK labour market. The nation health. Having a healthy people and nation is considered a very important value for the society. A healthy nation has a higher ability and a level of the happiness than unhealthy and sad societies. The healthy nation visit health centers and hospitals far less often, and its way what there are fewer patients and less pressure on the country health system. In 2023, almost 2 from 3 of the population of England was dissatisfied with their health, and statistics show that this trend can put a lot of pressure on the health system soon. Disease such as blood pressure, back pain, and diabetes due to the improper life and wrong nutrition. In England, older people pay more attention to the health of the other member of their family, and in the maintain they do not pay more attention to their own health. COVID-19, the coronavirus epidemic that spread all over the world caused the death of nearly 7 million people and put a lot of pressure on the health system of all countries. The effects of the coronavirus are long time. In the years when the health system was fighting a corona epidemic, many patients were with several diseases either stopped or postponed their treatment because the health system was involved and fighting with the mass of the corona patients in that time. So that treatment delayed. So now that treatment come back and they put pressure because they have patients now, and that treatment is comes back and it cause a double problem for health system. I choose Brexit as a global effect. So on June 23, 2016, the United Kingdom voted to leave. They voted to leave the European Union in the national elections, and the government was forced to accept the referendum result. So far so straightforward. However, what happened after the referendum was not so easy and simple. The lack of the workforce in England has been constant problem, and England has employed non-British working in the past years. In several fields, international employer is very necessary for England. For example, the health system in the different sectors. Prominent problem after the exit of England in the health system. A significant part of the workforce in the national health system, they were EU citizens or they are EU citizens. More immigration restriction for the EU workers and slow recruitment for the EU people, EU staff. Drug shortage and import and export restrictions. More than 5% and 9%, more than 5% and 9% of the doctors, 60% of dentists, and 5% of health professionals that are from EU. In the year 2060, 5% of total 100% of health system employees were European nations, European nationals. Every year, the health system in England needs approximately 2,700 nurses. And if the requirements in this previous year were not enough, this number will be added to the next year with the passage of strict rules for foreign workers. And this increase in the cost of living to the war in the Ukraine, fewer qualified people are applying for the work visa, and entering the UK living system. Brexit means end of the European laws and institutions. Although the supply of medicine is very important issue all over the world, and all countries are facing shortage of medicine to some extent. Brexit add one of problem on top of the other problems. In exchange for the more cooperation and unity, England left the union that it had been member of for nearly 40 years, and this caused a drop of the value of the pound and directly affect the price of the imported drugs. Ideas. Even such a natural disasters and the war disrupt countries' access to medicine because all countries needs to cooperate and send medicine to each other. Across the countries of Europe, 95% of the pharmacies are in the shortage. This shortage can be attributed to the war in Ukraine. But in the England, in the last 6 years, we are facing with two issues, which is caused drug shortage, Brexit and war. Another one is 20% increase in the tax on the income of the drug manufacturers and import of drugs, decrease in the value of the pound, that is all issues. Drug trends climb, drug traders claim that it has made UK an attractive place to do business. This question will arise: how can we control the leak of medicine? Preparation, the ground and encourage import and productions, which is all with the scope of the government and administrative policies on the drug shortage sectors. Fast and accurate publication of information related to shortage that should be quickly available to pharmacies and hospitals. Shortage of the drug with an efficient method and pattern and suitable program for the drug disruptions without any discrimination. Government contracts in the drug sector should be clarified by considering any inequality for the drug supply and drug production sectors, and the government should be responsible for any disruption and problems. Investment in health education. Since 2026, there has been 20% decrease in nursing application in the UK and 10.5 decrease in medicine and pharmacies. We also feel the decrease in non-British student in the health fields. The long period of study and the long period of the study and the high cost of the education of medicine and nursing makes them drop out of the school. Statistics shows that 20% of doctors and 12% of the nurse students drop out after completing the basic courses. What caused that? Not paying fair wages and raising their wages very little, stress and pressure at the work. It encouraged them to study in the other field and work in the other jobs. Where are the solutions? Motivating British students to study in health field, creating friendly environment in their studies, and paying fair salaries and salary increases for health system employers. In the end, conclusion: the health system is very vital system for the society. Perhaps any political approach and change and even climatic and environmental change will not have significant impact in the other system, but the health system will have bigger problem due to its sensitivity. If this health system is inefficient, will directly affect the natural growth of of the country. Therefore, more investment and more accurate uh, planning will prevent bad things from the happening in the future. Building suitable field for education at work with suitable salary for the young generation will make the country have more motivation and enter the system by their own choice and reduce the country's dependence on foreigners' ID. This investment also have positive impact on the national economy and will reduce unemployment in the country. Thank you so much.